Okay, so the first question is why we chose this piece of technology. We chose x-rays because we were kind of fascinated with how they're used in the medical world to see through skin, and we wanted to understand that better. The question is who developed or invented it and when. So it was invented by Wilhelm Conrad Rontgen in 1895. And then the next question is, has it been modified over the years and how? In 1913, the aforementioned Coolidge tube is invented, which creates x-rays through the use of vacuum tube. The main effect of these tubes is to enable continuous emission of x-rays. X-ray tubes similar to these are still in use today. In 1971, computed tomography, or CT scanning, was introduced into medical practice by Godfrey Housefield, who developed the technology at EMI Central Research and Laboratories. CT scans work by first taking a series of x-rays of a subject from every angle. Then an image is composited by the computer of a slice of the inside of whatever object is scanned. This allows doctors to see the inside of a piece of a tissue without ever making an incision.
Explain the physics behind it, including appropriate equations and vocabulary. What kind of waves does it use? It uses x-rays. What is the frequency, period, and wavelength ranges? Wavelengths range from 0.01 to 10 nanometers. Frequencies range from 30 petahertz to 30 exahertz, and periods range from 0.033 petahertz to 0.033 exahertz. Why are these waves used and not others? Benefits of using an X-ray over infrared rays in the medical field is that X-ray waves can see the integrity of bone, whereas infrared can't examine bones or body tissue. Infrared can only depict images that study the heat flow patterns in the body. Simply, another comparison in the medical diagnostics would be radio waves. Radio frequency ablation is widely known to treat tumors, where CT or CAT scans provide detail on soft body tissues like the liver or the brain.
Alright, so the next question is, how is this technology used, what fields is it used in, and then what are the applications? So x-rays are used in a variety of different fields, but some of the most common that we found were the medical, security, and manufacturing fields. X-rays are used for a multitude of things. In the medical world, they can be used to identify broken bones, tumors, things that can't be seen easily by the human eye. It also takes images of the heart in cardiology and can destroy tumors by damaging them. Security often uses x-rays to scan bags and identify objects that could be hidden underneath clothing. An example of this would be in airport security. Manufacturers use them to check the mechanics of their systems and also their products without having to take apart the entire product or machine. It helps them to identify like cracks and damages instead of having to take everything apart and then put it back together again. And then lastly, this technology is mainly used to take images of things that are unseen by the human eye, and it can show images of things inside your body, bags, and machines.
So question 5 asks for the pros and cons of your piece of technology. One of the pros is that it helps doctors painlessly diagnose patients without having to undergo surgery. Also, manufacturers can evaluate issues in their product without taking things completely apart. And another pro is that radiation levels are lower in x-rays than in CT scanners.
Okay, so the cons of x-rays are that even though it's uncommon, the radiation in x-ray machines can cause cancer or increase your probability of cancer. And then another con is that images produced by x-ray machines aren't as clear or as strong as those that are produced by CT scanners. When you weigh the risks and benefits of x-ray machines, overall x-ray machines will never be 100% safe because any machine that generates or exposes an individual to radiation is always going to have drawbacks. When weighing the risks and benefits, most people would conclude that x-ray machines are generally worth the risks. Medically, an x-ray has a greater probability of identifying cancerous cells and recognizing need for treatment than it does of causing cancer. In industry, it's more beneficial because the technology helps to do checks on machines without having to completely take them apart for evaluation. And then lastly, in security measures, the dosages of radiation produced by machines is so minuscule that the probability of it causing damage or cell mutation is little to 1. So whenever you're going through airport security, the radiation that the security checks produce isn't enough to harm you. And they're more helpful than they are harmful to the general population.